I'd argue that finger pain and finger injuries are probably one of the biggest hurdles in preventing climbers from progressing quickly. You can be on a training plan that seems to be working, you're getting stronger week by week, month by month, then suddenly you have a finger that feels like it's on the verge of injury, or maybe even more annoyingly, it's been weeks or months and you have pretty much constant tenderness in your finger. Your joint might be a little bit swollen, and sometimes your finger can start to feel better partway into your session. Up until a couple months ago, this has basically been my experience with climbing, especially when it comes to training and trying to push the grades. It felt like I could get stronger, but the thing that was always limiting me and setting me back was finger injuries or finger pain. Balancing the load, frequency, and intensity of climbing and training loads in order to best improve quickly while also avoiding injury is something that climbers continuously have to learn and improve on. Making training plans or decisions in your sessions based on your current collection of knowledge is a learning experience, and it's something that takes a lot of time to learn, especially as most of us are not pros and we don't have resources to professional person-to-person advice very easily. Most of us will just go online or try to find somebody strong in the gym that looks like they know what they're talking about. I personally have dealt with finger pain in my middle fingers for pretty much my entire climbing career. Now, I'm nowhere near a professional climber, I'm not a medical professional, but I want to share my experiences and how I've dealt with my finger pain and what I believe is tenosynovitis. If you want professional advice instead, I'd highly recommend checking out Hooper's Beta and C4HP, or however you say that. Or if it's really something serious, I do recommend just scheduling an appointment with your doctor or physio to really get it diagnosed. I think everybody's situation and everybody's physiology is going to be different. So I'm not here trying to diagnose or even really give a solution and steps to what to do, but this video is going to kind of serve more as contributing factors that I think really affect the development of tenosynovitis and overall the feeling of injury-prone fingers and painful fingers. And it's my hope that that'll be able to share my experiences with dealing with tenosynovitis, and maybe it might resonate with some people and help facilitate some critical thinking on training decisions that might not be the most optimal for injury avoidance. But those decisions are for you guys to make. I'm just sharing my experience. So here we go. So there's going to be 3 kind of main sections of this video. There's going to be kind of the bases that you really need to cover, and then 2 sections that'll kind of be more unique and hopefully will be things that you guys haven't heard of from other finger injury videos already. And I'm going to try to give you guys the timestamps so you can go and kind of skip around and reference back, but I really recommend checking out every single part because I think every aspect is really important, and neglecting any of them is really just going to set you up suboptimally long term and might put you at a higher risk of injury. But I'm not your parent, so I'll stop yapping and I'll just get to the video. First up, probably the most important thing, proper sleep. Sleep has a direct correlation to how well you perform in a session and how well you're able to recover between them. The climber that's able to recover the most will be able to train the most and improve the most. Realistically, you should be focused on getting the most quality sleep you physically can to recover the best. 7 to 8 hours is a pretty average range, but if you push another hour or 2 of quality sleep, you'll definitely benefit a lot. Quality sleep is arguably more important than the total amount of sleep you get, so I'd recommend do yourself a favor, make sure your room is in total darkness when you're sleeping, like you can cover up the little lights in your room. Make your screens automatically use night shift to reduce your eye strain. iPhone has a built-in function for this, and you can download this thing called Flux on PC, which does the same thing, basically making the light more orange as it gets closer to nighttime. You should also make sure that your room is cool and not stuffy or dry. Try to make sure there's not a lot of noise, or drown them out using a white noise like a fan or something like that. And you can even try to use wax melters with lavender to help fall asleep and increase the quality of your sleep. And lastly, it helps to avoid foods and drinks and caffeine before sleeping. I can go and throw a diagram up of that, which can be kind of difficult, but it definitely helps if you kind of suffer from indigestion or waking up early with some stomach pain or having to go to the bathroom. Next up is nutrition, which is kind of the same thing. More recovery equals more training and more performance. But I want to break nutrition up a little bit into kind of 3 different areas to focus on how they affect your recovery and contribute to injury if neglected. Protein is one of the most important things in my opinion. I think protein might be top 1 or 2 things that I continuously see climbers do wrong. A lot of people seem to think that eating a lot of protein means that you'll end up swelling up like a bodybuilder, but that won't really be the case unless you're training like a bodybuilder and eating enough calories in a surplus to actually put weight on. Protein is really important for recovery and for increasing strength and obviously some muscle size, but also in repairing and strengthening connective tissue. I've seen so many people surprised at just how much protein they should be getting. I personally weigh around 175 pounds and I typically aim for around 140 grams of protein a day minimum, which is around 0.8 grams per pound of body weight. And I'd say that 0.5 to 1 gram per pound of body weight is a pretty good range, but you might even want to go a little bit upwards of this in the case of a calorie deficit, which I think climbers can have an issue with not eating enough. Which kind of leads us into the next section, which is calories. Overall, calorie demands are largely up to you as an individual and your goals. Calories and weight are unsurprisingly very connected. With climbing being a strength to weight ratio sport, the topic comes up a lot, and I know that it's a kind of sensitive subject for a lot of people, but I do want to contribute to similar advocates that weight shouldn't necessarily be your primary focus when it comes to climbing. It's my belief that it's a lot more important to be able to train hard and recover well when it comes to climbing, which means getting enough quality food to support what you put your body through. So I don't really want to say that you should eat this many calories in this situation, but I do want to re-emphasize that if you're in a deficit, you have to make sure that you're getting enough protein, like I mentioned earlier. And just remember that your body needs fuel to function, perform, and most important for the topic of this video, to recover. I would also like to talk about overall food quality. I like to think of this basically, aside from just calories and protein, how good is the food that you're actually eating? Is it high in saturated fat, cholesterol, and tons of sodium? And is it highly processed and it gives you a lot of information? Or is it something that has a lot of micronutrients and vitamins that makes my body feel really good after I eat it? Inflammatory foods can contribute to finger issues like overuse and joint inflammation, and being conscious of this can help prevent exacerbating already pre-existing injuries or overuse. I also want to mention hydration. Hydration is really important for making sure that all the connective tissue in your hands are able to move properly. I almost feel like when I'm really dehydrated, sometimes the tendon doesn't move and glide smoothly, and the tendon sheath is in my fingers. It almost feels like it's getting stuck. And proper hydration also helps to alleviate inflammation, which can definitely help to reduce some overuse injuries like Tenosynovitis. Not to mention, dehydration levels are also shown to weaken tendons, which makes them more injury prone. Alright, next important thing, warming up. Mainly talking about progressive finger warm-ups here. Basically making sure that your fingers are 100% ready to pull as hard as you can in the session. This prevents possible injury-prone situations such as accidentally dead pointing to a hold and latching it with more force than your fingers are ready for. And this type of progressive finger warm-up works really well off the wall. You can use no hangs on a hangboard, or you can use a lifting block with an edge on it, basically tied to something, and you just pull on it statically. You can use any warm-up method you'd like, but I do highly recommend having at least something that works for you. Definitely don't need to take my advice on it, but I'd experiment with warm-up methods and just find something that works for you really well. And this last kind of foundational thing is training correctly. Training correctly is really important, but what do I mean by this? Everybody's training is slightly different. Even if your goals are the same, it's going to be a little bit different. But despite any of these differences, there's some things that no matter what your training looks like, you should definitely avoid. These are going to be things that increase the chance of injury, things that lower your training quality, and things that make it really difficult to recover properly. So these are going to be things like doing your strength or power training at the end of the climbing session, or dragging your session out way too long, as this is going to affect your ability to recover fully for your next session. And to prevent these, I would recommend doing all your real strength and power training in the beginning of your session, and to find your own duration and intensity for your climbing sessions to make sure that you're getting enough high quality training in nearly every single one of your sessions. You might want to take a rest day on those days where just everything's feeling bad physically and even mentally, because I will tell you from personal experience, having that extra session is probably not going to make you send the next grade when you're already completely thrashed, but an injury will definitely set you back more than missing that one session. Okay, and I'd say this is about the last of the kind of basic foundational stuff that I'd really recommend covering all of the bases on. It's not really anything that's like super out of the ordinary, but it is really important, and it is kind of like the foundational building blocks for recovery and performance. But now we're gonna get into some stuff that I don't think you guys have heard before. And I'll be honest, I believe I was doing all that foundational stuff right for a long time and still had some finger issues. So these next two causes, I think probably once I solved them, I think they pretty much got rid of all of my finger issues. It's been a good few months now and I haven't had any finger tweaks, so hopefully this will help you. So the first thing, I'm gonna just call it dynamic overloading on in-cut sharp edges. What the heck does that mean? I don't really know if that's the right phraseology for everything, but basically this is max effort and dynamic climbing at the end of the session. Basically being pretty tired already, you might be a good couple hours in your session and you're on some powerful, crimpy, really in-cut holds, and you're dead pointing to a hold, you're latching it. I think that you're very easily able to kind of overload the structures in your fingers by doing this, because if the hold is in-cut enough, it doesn't really matter if you're strong enough to actually hold it. Your fingers will be able to keep you on, which is going to be largely due to just friction and the angle just biting into your hand. And I would specifically like to highlight training boards. I think that a lot of training boards are really notorious with this, especially due to the nature of how board climbing is. Harder grades are typically bigger moves between okay-ish holds, but with also really good feet. So this ends up forcing big dynamic cuts with weird body movement through the air, which basically results in latching a hold, jumping, latching another hold, and basically repeating that. And due to the nature of this, it can be really irritating and really inflammatory for your fingers. I would argue that latching tiny holds, especially on, like, for example, the moonboard, was possibly the biggest contributing factor to my acute finger pain. When it's really tired and it's hard to hit it in an engaged position, that's definitely going to contribute to possibly some tenosynovitis or even worse, something else. And I personally just think that this style of dynamic climbing on these type of in-cut holds, it really makes it easy to overdo it, especially at the end of a session when you're tired. So to prevent this, I would really recommend building up your training in this way, doing dynamic kind of board climbing. I would recommend not just jumping and doing it 3 days a week when you haven't done it before at all. I would slowly ease up into it, and I'd also not recommend doing it at the end of the session. Make sure your quality is really high, make sure you're feeling good still. When you're starting to feel really tired, you probably shouldn't get on that. Maybe do some slab or some vertical wall climbing if you really want to just keep climbing. Alright, and now cause 2, repetitive training on edges with acute angles due to finger length. What does that mean? Getting into the real nerdy stuff, talking about finger lengths. If your middle finger is a little bit longer, you might have a pretty aggressive half crimp position, which over time could lead to some overuse, like tenosynovitis, for example. So basically, if you do hangboard training or block pulls, for example, and you notice when you try to half crimp that your middle finger kind of flexes up into a less than 90-degree angle, and maybe your pinky and your pointer finger end up being more straight and open hand, you can't seem to get all your fingers into like a nice 90-degree angle, you might get some finger pain, especially in your middle finger, if that's your longest finger, even if you're doing everything else in the video that I mentioned already correctly, which is kind of what I feel like has been my issue for a long time now. And just recently I started switching to an Unlevel Edge, and my finger pain has actually basically completely gone away. Like I've mentioned before, it's been a couple months now where I feel like my tenosynovitis has completely gone, and I would pretty much attribute it nearly entirely to switching to an Unlevel Edge for my training. It's much more ergonomic, it's more challenging on my pointer and my pinky, and it also allows my middle finger to be in a more ergonomic position that feels like it prevents a lot of overuse strain. I haven't been doing it that long, but I have noticed a lot of benefits from it already. If you feel like your middle finger is kind of always the problem finger, always kind of feeling a little bit painful or tweaky, then I'd highly recommend giving it a shot if your gym carries a block like this, or if not, and you want to just buy one on your own. I'm going to put the link to the one that I've been using in the description for this video, and it's not sponsored, but if you guys do end up using the link, you guys will be helping me out, so if you do that, I greatly appreciate it. And if you guys do end up giving it a shot, or you've tried this kind of thing in the past, I'd love to go and know what you guys think about it and how it's affected your training, either in YouTube comments or even messaging me on Instagram. And I do plan to make another video kind of entirely dedicated to just reviewing this lifting block once I've gotten a little bit more experience on it. So definitely keep an eye out for that if you guys are interested. Thank you guys for watching. I hope that this video was insightful and helpful. I put a lot of effort into this video, and I really hope that it helps a lot of you guys go and kind of pinpoint maybe some less talked about stuff when it comes to finger strains and pain and injuries overall. Thank you guys for watching. I'll see you in the next one.